Okay, so this video today is going to be a little bit of an introduction to the skeleton. During the course, the physiotherapy 3-year course, you'll get to know the skeleton better and better. But what you'll realise is that in the introductory week of your course, or induction week, you'll actually be given your own box of bones or your own skeleton. It won't be put together in this same format. Essentially, you will have one of each bone, but they're there for you to explore and to get to know that bony anatomy better. So what I want you to be able to do as students is that when you're looking at a certain aspect of the body during weeks of teaching, is that actually you pull those bones out related to that teaching, look at the key bony points, look at key muscles where they attach, where key ligaments attach, and actually start to, over the course of the first year, which is when you'll actually be able to keep hold of that set of bones for yourself, is actually to label up not only the bone itself, but those key bony points associated with that bone and the joints and things that are attached there. What that will help you to do is when you come to revise your anatomy, you'll be able to go back and take a look at your skeleton and have an idea visually of what those bony points are and get to know what attaches there. So in terms of your skeleton, and what I'd like to suggest is that while you're watching this video, you get out your box of bones and start to visualise actually what I'm pointing to and what bones those relate to that you've got there in your box. And you then will start to visualise your skeleton in this manner as opposed to separate bones that you've got. So commonly the skeleton is split up into different aspects. So we've got a head or the skull, we've got the thorax, the pelvis, the upper limbs and the lower limbs. What you'll start to realise when you start to read your anatomy books, and for the sake of this course, that is currently Moore's. So when you're looking at your bony anatomy, relate back to Moore's, or there's Ackland's anatomy that you have access to via the KLE, that you can get a closer look at these anatomical structures. So we start to see examples of different types of bones. For example, the humerus here, forming the arm, is an example of a long bone. You've then got examples of things called flat bones, which an example may be the scapula, if I turn around the skeleton, and this flat bone that you're seeing at the back. Okay, we have an example then of other types of bones, so short bones, which we can see examples of in the fingers, things like the phalanges that we've got there. So just to start to introduce you to some key bones as we're running through the skeleton here, and then what I want you to do is, as you go back to those lectures about those different joints, pull that bone out and actually start to label some of the key bony points. So starting up here with the skull, which you'll more commonly see known as now as the cranium. So again, different parts of that bone. So we've got our occipital bone, which essentially is the back of your skull. And again, I'll remind you about this when I turn the skull round. We've got our temporal bone, which is at the front. And essentially, we've actually got these temporal fossas, which are our little indents here on our temporal bone. We've got our maxilla here, which essentially is this aspect, and then our mandible. And they form together to actually form the joint, or the temporomandibular joint as it's known, which sits here on the side of the skull. Essentially, that is your jaw, where the opening and closing of the mouth comes from. You'll start to see then, and again I can show you this a bit more closely at the back, but joining to the skull, essentially you've got the vertebra of an atlas and axis. So you have one vertebra which forms the axis, one vertebra that forms the atlas, and that again allows rotation. So on top of this peg here sits the back of your skull, and around that the head and skull can rotate. These bones, as you see coming down here, are your cervical vertebrae. And again, we can see those more closely at the back. And what you'll start to need to know for first year, and we're not going to go into masses of depth on this video, is to know the different portions of your vertebra. So what are they called? What are these bony points coming out to the side called? What's this body of the vertebra called? What's the bit at the back that sticks backwards called? Again, that may form part of an IPA situation, and again, it's the type of knowledge that you'll need to have when going out onto clinical practice, but we're not going to cover that in depth in this video. Okay, so coming on to clavicles here and a clavicle on this side. So the clavicle joins with the sternum here at the front, and this joint here is known as the sternoclavicular joint. So a joint between the sternum and the clavicle, sternoclavicular joint. The clavicle then traces along to join this part here that's actually part of the scapula, or shoulder blade, as you may know it in layman's terms. So clavicle comes along and meets the acromion of the scapula, and here is called the acromioclavicular joint. Again, in terms of the scapula, we can see more of the bony points when we come round to the back, which I'll talk about. But this bony point here is called the coracoid process, and you'll be able to visualise that from me pointing. It's actually part of the scapula, but it's key and important for the shoulder joint, and key for attachments of muscles and ligaments, and you'll start to learn that as you go through the course. Next bone on here, so with a humerus, and looking at your textbook of Moore's or looking in Ackland's anatomy, I want you to start actually starting to be able to picture and label what bony points there are on the humerus. So humerus being here, so terms that you'll start to recognise, you've got the proximal point of the humerus here and the distal part of the humerus here. So proximal being closest up, distal being lowest down. This bit here, obviously what you'll see, this part of the humerus forms the actual ball of the shoulder joint, and this part here on the scapula forms the socket of the shoulder joint. So this is known as the humeral head, and that forms the ball of the shoulder joint. This aspect here is known as the glenoid fossa, and that forms the ball part of the shoulder joint. Again, you'll get to know that in more depth during your lectures. So these two bony points here, again, very important for muscle attachment and stability around the shoulder. So here we've got the greater tuberosity, and here we've got the lesser tuberosity. Coming down, what we'll see, this aspect here, is that the other end of the humerus, or the distal end, actually meets with the radius and the ulna to make the elbow joint. So we've got here condyles, as we call them. This one, again, if we imagine that the arm's in the anatomical position, medial condyle, lateral condyle, and that is of the humerus. The bits that stick out most in terms of the condyle are what we call the epicondyle, and you'll notice that is true of the knee as well. Coming on to the bones down on this side, what you'll notice is that thumb side sits your radius and little finger side sits your ulna. Again, then we've got the bones of the hand. For the sake of this video, we're not going to go into the detail of each individual bone of the hand. That's something for you to look up as self-directed study, and something that you'll go into more detail about when you actually have your practical sessions and work packages around the hand. But essentially, this area of bones here is known as our carpal bones. So these two rows here, and then we've got our metacarpals, and the bones at the end are known as our phalanges. Okay, so again, coming on to the thorax around this area here. So attaching to the sternum here, we've got our areas of costocartilage, and then coming round onto our ribs as we come down here. So what you'll notice are, by these bottom two ribs, is that actually they make connection from the posterior part of the spine, but actually are known as what we call floating ribs, because they actually don't attach all the way round at the front. So underneath here, if you could visualise, would be our thoracic vertebra, and then when we start to come down to this aspect of the spine, we've got our lumbar vertebra coming into our sacrum, and again into our pelvis here. So thinking about joints here, so this area here, where our ilium, which is this aspect of the bone, joins with our sacrum, and that's known as the sacroiliac joint, and we can visualise that from the back as well. These bony points here around the pelvis, again you'll start to learn more, but we've got here our anterior superior iliac spine, and again key for muscle attachment. So same on this side, our anterior superior iliac spine and our anterior inferior iliac spine sitting on this bony point here. So again, thinking about different parts of our pelvis, we've got our ilium, which is this surface here, our ischium, which is the bit at the back, which again I'll show you when we turn it round, and our pubis, which is the bit at the front. So our pubic tubercles are these bony points here, and our pubic symphysis, where our pelvis joins at the front, is this joint between the bones here. Okay, so coming down again onto the lower limbs. So now this long bone here, or longest bone in the body, as it's known as, is the femur. So the femur is part of two joints, our hip joint up here, more proximally, and our knee joint more distally. And again, there's lots of key bony points on the femur, and that's something that I want you to start to label as you work through your studies and as part of your directed study. When you're looking at the hip joint and the knee joint, label those bony points on your skeleton that you've got at home. So looking about some key bony points around here. So the socket part of the hip joint here is known as the acetabulum. So that forms the concave surface of the hip joint. The head of the femur, similarly as to the head of the humerus, this forms the convex surface of the hip joint. Thinking about the bony prominences, similar as we've got up on the humerus, we've got a greater trochanter here, which is this large chunk of bone here, and we've got our lesser trochanter. And as you go through your studies, start to learn more about muscles and ligaments, you'll notice that these are key points that we will learn to palpate on the body, and key points that muscles and different soft tissue structures attach onto. What you'll come to realise as well as you're learning the skeleton is when you come to surface mark joints, or be able to visualise where your anatomy is underneath your soft tissue on a patient, they're the key bony points that you're looking for. So greater trochanter here, lesser trochanter here. Coming down that aspect of the femur, you'll now notice that again, we're forming these condyle type structures again, similarly as we did on the humerus. So if you think about the anatomical position, we've got our medial condyle of the femur here and our lateral condyle of the femur here. And again, what you'll start to notice about different joints is these two condyles together, this one here and this one here, form a convex surface, which then joins with a concave surface on this bone here, which we know as the tibia. So when we're thinking about the knee joint, we've got a convex femur working with a concave tibia. And these joint surfaces here are where the knee joint comes into action. On the front here, we've got our patella. And again, that's what we know as a floating bone. So that's attached onto the front here with soft tissues. What we know here, so we've got the medial aspect of the patella, the lateral aspect of the patella, the apex of the patella, which is this pointy part, and the base of the patella, which is this more flattened portion. And again, key for soft tissue attachments, particularly the quadriceps, which comes over the top here. So coming down now onto the tibia, which we know to be this bone here. Again, we've got our tibial condyles, similar that we have on our femur, and our epicondyles, the most outermost pointy portions. And on the front here, we have our tibial tuberosity. And again, you'll come to know that as a key bony attachment for the quadriceps, and a key one to label up on your skeleton. Again, lots more in-depth knowledge. I'm just going through some of the basics to introduce you to the skeleton today. So tibia here, and what you'll notice, the tibia not also forms part of the knee joint, but again, and I'll come round to show on the other side, but forms the ankle joint as we come more distally. So if we move laterally from there, we'll see again this thinner bone that's here, and this is our fibula. So tibia is the larger one, fibula is the one as we move more laterally. So head of fibula is this outermost lateral portion here, and again, that's one of the bony points that you'll go on to palpate and identify on each other during your practical sessions. If I then move on to this side, Again, I'm not going to go into masses of details in terms of each individual bone of the foot because you'll cover that later into your lectures, but it's also something worth looking at when you're looking in moors, when you're getting to know your skeleton better. Pull these bones out on your foot, get to know what they're called, which one goes where. Again, it will be important when you go to do your lectures on palpation. If you're already familiar with some of the bony anatomy, it will make life a lot easier when you come to do those sessions. So as the tibia comes down here, we get that forming this concave aspect here of the ankle joint. So these two outermost portions here, so you'll see one on the tibia, one on the fibula, are our malleoli. And if you were to visualise on your own ankle, these kind of sticky out bony points here that come just above where your trainers naturally lie are your malleoli. And they're points that you'll start to palpate when you study the ankle. The other bone, this chunky bone here, which forms the other part of the ankle joint and forms the convex surface, is known as the talus. And again, really important bone to get to know that forms the ankle joint with the tibia. If I just turn the foot slightly, big bone back here is your calcaneus, and that forms your heel bone. So again, not going to go through the individual bones, but we've got our tarsal bones here, which form these two rows of bones here, our metatarsals, and the bones at the end are phalanges. And again, there for you to look more closely into those individual bony names. I'm just going to turn around slightly. Okay, and thinking about those bony points as we were talking about from the back. So occipital portion of the skull, as we see up here, which I'm just showing you from the back now. Cervical vertebrae at the top, so 7 cervical vertebrae. What you'll notice are the cervical vertebrae, thoracic vertebrae and lumbar vertebrae all have different features. I'm not going to go into that in detail in this video, but it's something that you need to be able to be more familiar with, why they're different, so what different functions do they have that actually require them to be different. Again, may form something that you're expected to know out in placement, or may form part of an IPA scenario that you're asked to distinguish, to pick out which ones are cervical, which ones are thoracic, and why. What, in terms of their function or purpose, means that the vertebra has to perform in that way or has to have these kind of anatomical features. Okay, so coming then on to thoracic vertebrae, so we've got 12 thoracic vertebrae, and those thoracic vertebrae, you'll see here, make joints with the ribs. And as we discussed before, we've got these lower ribs that attach at the back, but don't attach all the way around at the front, and are known as floating ribs. Coming on to the kind of thicker, chunkier vertebrae down at the bottom, we've got 5 lumbar vertebrae at the bottom, and then this bone here is our sacrum and our coccyx, again, which is this kind of pointy bit that comes back here. Just as we did on the front, where the ilium portion of our pelvis joins our sacrum, we've got our sacral iliac joint, and we knew that this part of the pelvis was known as our ischium, the bit at the back. These are our ischial tuberosities, and again, as you get to know your anatomy better, you'll start to learn about key muscle attachments that attach here. And again, all you can see here is our knee joint line from the back and our ankle joint line from the back. But again, start to get your skeleton out, start to become familiar with all the bones that we've gone through, start to get an idea of each individual bony point and what may attach there, what soft tissue structures. So just to finish a little bit about the scapula, so we can see this from the back, we've got our scapula in contact with our chest wall here. So starting to think about the terminology you're coming to get to know. Medial aspect of our scapula here, or medial border as it's known, lateral border of the scapula, inferior angle, and our acromion as it passes and joins up here. And you'll notice these grooves, these fossas, when you get to know your anatomy better, they're key in terms of where our ligaments, where our muscles lie.